Welcome to the Assembly of Bishops Task Force on Mental Health's discussion on grief, death, and grieving. I'm Bishop John, and with us today is Father Adrian Budica and Sarah Byrne-Martelli. Both of these Orthodox Christians are chaplains dealing daily with people in medical life crises, as well as their families, clergy, and friends. Father Adrian also supervises the clinical pastoral care efforts of St. Vladimir's Seminary, and Sarah balances her chaplaincy work in Boston, as well as her family. Sarah, what is the most important thing for us to understand as we try to witness to each other when we're stressed and face life-threatening situations?
I think right now, the thing that I've been saying to myself and to my friends and to my family is that God is with us. So wherever we are, we sing that a lot during Lent, for God is with us. And so God is present and feeling all things. And so I think especially right now in a time of stress or in a general time of loss or grief, just to be gentle, to be compassionate with each other, to try to understand that everyone is going through their own struggles, and to give people the benefit of the doubt as much as we can in times of stress, to choose our words wisely, and to examine yourself and the way that you interact with others, and to pray, to be guided so that we can be a good listener and a compassionate person, and to really to do our best not to judge, and to understand that God is with us, and God is the one who really is responsible for that, and we are not. Instead, we are there to hold space and be kind.
Father Adrian, Sarah emphasized what I would call the importance of gentleness and kindness. How do you convince seminarians that it's really beneficial and helpful for us to be kind?
Well, to echo what Sarah, what you just said, I don't think I can convince any of the hearts. If nothing else, Christ is convincing them from the inside. In as much as they're attentive to the Word of God working in their heart, I can hope to be attentive to the same Word of God, and hopefully if I hear it, if I'm connected to Christ, I can hope that I can hear His voice and say, "You, Lord, speak in their heart." And that being said, it's a matter of being kind with each other. So the work of supervision, if you will, we talk a lot about parallel process, which means that what I try to do with students, I hope that I parallel and I model what I want them to do with others. That means if I don't want them to be imposing or forceful, on people, especially difficult times, I myself try the best way that I can not to be imposing and forceful. We have guidelines where I say, do's and don'ts, and basic do no harm, which is where any healthcare professional starts. But from there on, it's more of working and really embracing when people come with their vulnerabilities, and when they fall short, that's okay. I work with them the way I want them to work with people. Theologically speaking, for seminarians, it comes down to the theological assumption of what we do here. And in this case, it goes to understanding what is suffering, what is death, and what's the meaning of it. So in this case, anytime one is challenged and one maybe has a difficulty and they're struggling, maybe their own emotions are keeping them from being present with one in a time of suffering. They work to understand what that suffering means for their own. And what does being in suffering, what does dying every single day means, as we are also Christian, and we say my life, to quote St. Paul, is to die with Christ, right? We die every single day.
Thank you. Sarah, would you talk a little bit about encountering people who are frightened or angry or depressed or in crisis, and what that does to you, and how you do, as Father Adrian says, still show compassion?
Yeah. So, in the hospital, I see patients who are facing all different types of situations. Some are, end of life. Some are sort of a new diagnosis, change in prognosis. So a lot of people are really off kilter, and they're away from their communities. And especially right now, they don't have their normal supports. And so I really kind of start chaplains like to say, we meet them where they are, but really to try to come with an open heart and open mind, not have an agenda other than to really be present and to listen to their words, but also to hear what's underneath their words, like kind of like the emotions below the words, kind of the music below the lyrics, like we like to say. So if I find that people are expressing, well, sometimes people are really quite open with their emotions right away. They're angry at God. They're angry at this diagnosis. They say, why me? How am I going to deal with this? There's grief. There's crying, all those kinds of things. So first to let them be the way they are and to not shut it down and to not try to fix it right away. And there's some people, I think some chaplains say, like, it's even like, don't give someone a box of tissues when they're crying, because you could if they really need it. But, if even just like immediately giving them a tissue is like, stop crying. So instead to kind of give them a sense that I'm here, I'm going to hunker down and kind of be present with you. And I'm going to let you express what you need. Now, at the same time, I have to be aware of what that brings up in me. Sometimes I might find myself feeling really sad when I'm with someone or starting to feel anxious. And so it's important to understand that that's arising in me. And maybe that's because they remind me of someone I love, or they bring up a fear that I have. Sometimes I have patients that are the same age that I am. Right now I have a 42-year-old patient in the ICU who's married, who has one child, a son, which is exactly like my situation. Of course, it's completely different from my situation too. But instead to kind of be able to name that and to connect, but also to have my own appropriate boundary and to understand that this is not me at the same time. You mentioned also depression. So depression, I would put in a different category. Depression and anxiety, we can address sadness and feelings and disconnection and grief and those kinds of things. If someone is depressed in a way that is really like a physiological situation or anxiety, and they are short of breath and they can't even be present, then I would be working with my team and make sure I talk to the physician that they work with or the nurse practitioner to make sure we have kind of a multidisciplinary approach too. But I think I try to show up and be open. And also certainly I might pray with them. I can name those feelings for them. We look in the Psalms, every emotion in the entire, universe is present in the Psalms. And what I love about the Psalms too, is they don't mince words, right? They're like, God, I'm alone. Everything's horrible. But oftentimes at the end of the Psalm, it returns to praise, and it returns to gratitude, but you are present with us and we remember that. So it can be both. We can be angry and sad, and even in that still say that God is present with us, to kind of hold those things together. And I think that's something that as Orthodox Christians, we really have kind of innately in the faith, is this balance of these kind of holding two different kinds of emotions or two different kinds of theological concepts together at the same time, and to be okay with that.
When is it normal to be angry or frustrated or very, very sad? Is it normal to be depressed when you're dying?
That's an interesting question. I see all different things. I could tell you what I hope for myself, right? Mm-hmm. What I hope for myself is that as an Orthodox Christian participating in the life of the church, whether virtually or in person, praying, having a rule of prayer, I die daily, like as St. Paul says, that if I were to receive a serious diagnosis or something, that I think I would want to be gentle with myself. And I imagine I would feel sad. I would feel angry. I'm human. At the same time, I would like to think that I have a community and a cloud of witnesses around me who can support me and who have been through this, in the life of the church. I do think I see a lot of people who are angry, a lot of people who have regret at the end of life. They wish they had done things differently. You see like 10 things I wish I had done differently at the end of life, like these, articles and things, but they're true. Some people have not really used their gifts or been kind to people, or they have broken relationships. So I see a lot of that too. And I think that is a normal reaction.
Father Adrian, does being angry or depressed mean that you don't have hope or you don't have faith?
Not necessarily, and even in defining those two, I think we or I can speak for myself as Orthodox Christian, we might be quick to pathologize, which is why when I work with students, they tend to put everything in one category. Sadness, when I say, when in your life have you felt sad, immediately they think of depression. And when I say anger, they might be thinking of rage, of going and breaking things. And when I say, how are you afraid in this moment, immediately they think of anxiety. So just to separate, for anybody in a clinical setting, they know that those category and those that are actually, pathologies such as a mental illness, there's a certain category and a long time before one is actually, if they are struggling with anxiety, clinical depression, clinical anger, that's quite different than the emotion on its own. The emotion on its own, I think, is just a natural reaction to a very unexpected challenge upon us. So that's how I define it. The emotions, there's a range, if you will. There are 9 words that we can use for anger, between, the most basic frustration all the way to one acting upon it, and God forbid when they do get to a point where it becomes destructive. So theologically speaking, I would say, it comes down to how we understand human being, the anthropology of where is the place of suffering in our life. And in this case, how do we define this concept, which is basically a new concept, the psychological emotion in the Orthodox tradition. And with that, I see it again, I define the emotion itself, the immediate response is just sometimes to students, I say, think about it as the light that goes on your dashboard. If you're driving a car and your check engine goes on, one way of resolving it, you go and you take out the bulb. Now you don't have a check engine, all right? Well, that's one way of dealing with it. But then again, you might also look and see, well, maybe there's something going on. Maybe I should go and, to a shop and find out what's behind it. So in the same way, that immediate anger or that response might be just a bulb that something is happening underneath. And then there are different theories of trying to understand that. Again, some might go for depth psychology, some might look for behavioral, cognitive behavior. Either way, the emotion on its own, I think, is a natural response and something that's pointing our attention to something that we need to attend to. Theologically, I might actually challenge myself and others to say that emotion might be one way of God, calling us attention. I get myself busy with doing a lot of things. So that means once in a while, that emotion, that unexpected place, yesterday we were reading about the Samaritan woman. It's not like she planned to be at the well and to meet with Christ. She just planned to be at the well, but that's how she met Christ. So the same way, in some of those unexpected moments, God may be calling my attention to things where I myself can get myself really busy in my own daily routine and forget about what the real important things are.
When is anger and depression part of a process of adjusting to something that we just find out about and is a surprise to us, or something that we've been experiencing for a long time? Sarah, would you help me out here?
I think it's definitely part of it. I mean, it is. I think it's an appropriate part of a process that, I would hope. If I find myself never having any emotions, then I'm worried that I'm turning into some robot. I've been working for 17 years in an incredibly challenging, environment of healthcare. And so, when I'm with people who experience these emotions, I too have my days where I'm feeling like, this is wrong. How could this be happening? I look at a beautiful family and, they die tragically or a child dies. And of course, if I was just like, it's part of life, I think then maybe I should take a vacation for a while. I think to have a response, it means you're being present. You're listening and you're watching and you're being observant. And really part of it for me is being able to be present is the gift. That's the most important thing as a chaplain, or really any caregiver, is to really take that in. At the same time, we also want to maybe reassure someone that it's part of a process, and the only way to really move through this is to experience it. And certainly with grief, these times when you have a flood of tears, or times when you feel angry or you feel just disconnected, allowing yourself to feel that way without judging yourself is very important, because that's really the only way out of it. Now, of course, there are ways that you get stuck in your anger, right? Or stuck in grief, and you can't leave the house and you can't get out of bed, or you just rage at everything and you're yelling at your family when really it's about a different thing. Now that is different. So we might talk more about the passions. That's something that we could talk a little bit more just theologically, and or we could talk about, as Father Adrian mentioned, getting some help on a more clinical setting in terms of therapy, in terms of talking to your physician. So, again, it's kind of both.
Thank you. How has COVID-19 or this coronavirus impacted your work as chaplains? And
you want to start, Father Adrian?
Okay, Father.
I'm grateful that you and I have recorded a recent episode, and we were talking about it on our podcast. So there's been a lot of changes from the basic way of providing spiritual care. So we reduced the visits on site and the face-to-face, in-person type, again, due to strict regulations. So we included telechaplaincy, visits by phone and by video conference in as much as we could. And a lot of work in the past 2 months has been staff support. So those that are really present, and they're very much, the whole hospital has been integrating a lot of activities to support those that are at the front lines, as we call them.
Sure.
And then there's the work. We could expand a lot on what spiritual care might look by phone. The no visitor policy has been quite difficult on some family members. So at the time of death, they have made the chaplain usually is the one facilitating and advocating to allow maybe 1 or 2 people in. But sometimes if the family member is infected, or they're a certain age and maybe they cannot be there, it makes it really difficult. So that means for a few months we had people that passed away with very few, if any, visitors. Sometimes the nurse that goes there, for a 12-hour shift, basically every day becomes almost like their closest human, really. And then obviously they'll be affected in how the person is there. So we've been trying, to connect them by phone with the family members, to offer spiritual care to family members at home. Those are the things that are most present in my mind. How about you, Sarah?
Yeah, very similarly. So I'm under palliative care, so I'm kind of in a different department than the rest of the spiritual care team. So for me, I had a couple weeks from home, working from home, calling families again, sometimes calling patients if they're able to speak on the phone. But since I have mostly palliative care patients, many of them have serious illness and advanced symptoms, so can't really talk on the phone. So I did come back. So I've been back in the hospital now every day, kind of full time. And one obvious difference is I'm wearing scrubs every day and wearing scrub caps and all the PPE and the mask. And it's become so clear that the nursing is really doing the majority of the work right now in person for COVID patients specifically. I have visited some COVID patients who are in spiritual distress, especially because there are so few chaplains in house right now. Like I had a patient who was in his 90s who was blind and very hard of hearing, who was very anxious, very upset, asking over and over, was he dying? This person he can't have a visit on the phone. He needs an in-person visit. He was Catholic. So I went in and I gowned up and got all the thing. And then I went in and just stayed with him and sat with him for half an hour and was able to hold it. He just was like clutching my hand and we prayed together. And so I think it really calmed him down and actually he recovered. So that was pretty amazing. God bless him. And so we've also had, unfortunately, a lot of, I would say, couples or family members who are both COVID positive, and a couple where the wife died, but the husband didn't. And so but the husband is still in the hospital now he has a trach and recovering from being in the ICU and waking up to this new reality, this new grief that his wife has died. And also dealing with the physical effects of having been in an ICU for 2 or 3 weeks. So just, it was I went in to see him and support him and sit with him because he just was so alone, but also really couldn't verbalize what was going on. So trying to name the grief of someone who has kind of a slightly altered mental status, but is clearly like isolated, alone, and grieving in some way. That was hard. That was a hard day. Also, I think the other thing is that Father Adrian remarked on is it's limiting the visitors. So if we have patients who might be very sick, but not end of life, they cannot have visitors. And so I'm trying to provide continuity for some of my patients who might be critically ill, but you know, they're having treatment, and maybe a month from now, they'll probably be able to be discharged. But right now they're alone, and it's a long day alone in your hospital room, watching, you know, reruns of Friends on TV. There's only so much you can watch. So I've been trying to, you know, bring them reading material, read their mail for them, you know, pray with them, bring them just different things to help them feel less alone.
So when grieving is complicated, and maybe all grief is somewhat complicated, we all want to help. What are some things that you should say and some things you shouldn't say? I pose that question again to both of you. What help is helpful and what help is not helpful?
Yeah.
Well, I guess so. I just wrote my thesis for my Doctor of Ministry on grief and bereavement in the Orthodox Church. So I have a lot of thoughts about this, but certainly there's a lot of. So first, people don't know what to say. Okay. And that's okay. So even if you don't know what to say, that's okay. If you're with someone who has experienced a loss and you want to support them, it's okay to say, I don't know what to say. I'm so sorry. My heart hurts for you. What you don't want to do is turn it into your own grief. Say, oh, you know, I lost my dad too. Let me tell you about it. Because that takes away from them. Just try to stay in their grief, just even for a few minutes, without bringing up your own story. You might think that you're trying to like make them feel better and connect with them, but really what it does is almost feels like a competition, or you know, you're trying to you're just listening so that you can tell your own story. So we want to avoid that. We want to be careful, you know, about saying kind of theological or spiritual things like God must have needed an angel, or, you know, that's not even what we believe about dying, but, or at least you have another child, or, you know, at least you have had a husband, things like that, or you can always have another child. Yeah, of course, but I want my child that I had. So I think we do our best. I mean, I think there's so many well-intentioned things that people say, but mostly just show up, maybe bring some food, maybe drop off something, you know, and just say, I would love to listen. And you can ask them about the person, like, or tell them a story of something you loved about their loved one. You know, I love hearing stories about my grandma who passed away. I mean, she was a hoot, and I love hearing stories about her. And that doesn't make me feel more sad. It makes me feel like she's known and she's remembered, and that's beautiful. Yeah, so those are some of my tips.
Thank you. Father, anything to add?
Sure. Liturgically speaking, the power of the ritual, and this is true at the hospital also, is unfortunately this time it made it really difficult. I mean, even in our Orthodox Church, the funeral had been reduced to very few people. Now, that being said, I know priests that have arranged any kind of meeting by Zoom, which is the way we're meeting now. And then, God willing, as we slowly reopen, I'm hoping that the memorial services, I do believe that ritual has something very powerful for the family and for the community to embrace them. I'm aware that sometimes, you know, there's a lot of people there, sometimes hundreds of people. You don't get necessarily, you know, to talk a lot in that time. And it's important, the ritual, to acknowledge the loss itself and to celebrate, to put it in the context of the life of the church, makes a difference. And then to echo what you said, Sarah, to check in, you know, from time to time, and to accept what somebody might be going through. Again, going back to the definition, grief is a universal emotion experienced very individually, very personally. That means I absolutely cannot pretend that I know, or I should define how one should be grieving. You know, if we have some guidelines, the process might be looking, you know, you have 5 stages or whatever. It absolutely does not mean one will go through it in the same way. And even worse, it doesn't give me any permission to tell somebody you're grieving correctly or you're not grieving correctly. So if I am calling somebody again, should be no agenda. Going back to what you said earlier, Sarah, just be present with one. And if one day they might be in more anger, that's okay. You know, the next day there might be more sadness. The next day they might be going back and forth. It's part of their process. The phone call or however it is, you know, to follow up with them, offer a prayer, you know, with them. Is not to correct them and to say, oh, well, you shouldn't be doing this, you should be doing this. It's more of a creative and open space of how are you feeling today? And then based on that emotion, you know, how is that different maybe than yesterday? Any of that. The last thing that, again, echo to what you said, Sarah, a lot of well-intended people do silly things in a time of grief, because I think it's likely because they don't know maybe how to respond to their own emotions. So chances are, if I hear somebody and their emotions are strong, it's going to do something to me. And if I don't know what to do with my own emotion, again, the type of, oh, I'll bring a casserole for you and I'll load you up with all kinds of, again, it's well intended, that sometimes it's needed, but sometimes it just can become overwhelming and people get oversaturated. I see it at the hospital at this time. Most, you know, people that are in the community, maybe they're in their home and they want to help the hospital, and sometimes the hospital has to say, well, thank you, and at this
No
time
more
please
donuts.
Exactly, please stop sending us this and this and this, because we'll kind of like, this is closer for a person grieving. They know how to ask for help. So if at some point there might be, sometimes they don't know, but it shouldn't be about imposing. Like, just, it makes me feel better if, you know, I cook for you every day for a week or so. That's fine, but always check back and see if that's meaningful to them. And if not, do not impose any of that out of your good intention.
Well, and that's another thing that reminds me too. I think oftentimes after a death or a loss, there's an outpouring right away, like in the first couple weeks. Okay. But then a month and a half into it, the person is often still deeply in the throes of grief, and like the calls have kind of stopped, the flowers have stopped, the funeral happened. So I think if you really want to be supportive of someone, to check in like once a week, or if they're, you know, out of town, send them a text. I'm thinking of you. Write them a note once a week. I went through a loss, and my best friend, I'll never forget this. She sent me letters in the mail like every 3 or 4 days, just like weird random, like a recipe or some little note or a funny thing she cut out from the paper. And it was, she did it for like, you know, 2 or 3 months. And I have all the cards, and it was just, don't worry, you don't need to respond to this. I'm just thinking of you, and I love you, and you're awesome. And I'm, you know, I'm praying for you. And that was amazing. I'll never forget that. And so to be able to do that for someone, not just in the initial phase, but, you know, 2 months out, 3 months. And that's one thing that I think is so amazing about being Orthodox, is we have the funeral, but then at 40 days, we revisit the grief. It's not like, oh, it's done. You know, we revisit it, and we sort of mark it as a particular time, maybe to start resuming some more normal activities. But it's a communal way to revisit what's already present, and then to do the yearly memorials. We don't pretend that grief is something that you sort of close the book and it's over, but instead that over time it changes, and you kind of relocate it in a different way in your life, but that you still have this ongoing relationship to the person that you've lost. You pray for them. We hope that they pray for us. So there's that connection too.
Any final thoughts?
Christ is risen, and he did rise by trampling down death by death. We go through suffering, and that's the model that he has given us. That's, in a nutshell, by dying.
And Sarah?
And to that, yeah, I mean, that's the thing, is being in the hospital during this time through Lent and going through Holy Week and Pascha. I mean, what a gift it felt like. It's been just to sing, to have like the Paschal Troparion in my head and hear Christ is risen, just playing all the different, you know, all the different melodies and the different languages and the different versions, just to have that as my prayer when I'm doing this work. That's how we do this work, is to say that Christ is risen.
I thank you both for sharing yourselves with us today, and also for sharing yourselves and your faith with all the people that you minister to. May God continue to strengthen your ministries and guide you to serve all of his people. Thank you very much.